Hi everyone. So today I'm going to talk to you about rhinoplasty surgery, or as it's better known, nose job surgery. So rhinoplasty surgery is actually my favorite surgery. I've done many hundreds of them, and the reason it's my favorite surgery is because I think it's the surgery that most incorporates surgical technique with art and with good judgment and a good eye. I think the best results are when a patient doesn't treat just the nose but looks at the overall face and tries to create a nose that is harmonious with the rest of the face. And that's where people say it looks natural, looks like the nose I've always wanted. So that's always my goal with rhinoplasty. So most patients will come in and they're going to complain about specific things about their nose that they don't like a hump or a nose that's too wide or maybe a nose that's crooked. And obviously I always take that into consideration because I obviously want to give the patient the result they're looking for. But I look at the nose globally, then I look at the face, and I really kind of, in my mind, do the measurements that are what we call the standardized ideals, the ratio of the size of the nose to the face, or the distance between the tip of the nose and the chin, or the tip of the nose and the forehead. So these are all things that are going on while I'm examining a patient's nose, and then I'll give them my point of view as to what we should do. And patients have to keep in mind that a nose is a three-dimensional structure. If you change one of the dimensions, you automatically have to adjust the other two dimensions to keep everything in balance. One of the tools we have in our clinic is the Vectra 3D photo system, which is a great tool to help patients visualize what the results of their surgery can look like. And this is the Vectra here, so we take a very high-definition photo using 6 cameras, which actually allow us to rotate the patient's face in 3 dimensions. And once we have the dimension that we want, or the view that we want, we can make the adjustments according to what the patient desires. So for example, in this case, the patient complained of a nasal tip that was a little bit too wide. So with the Vectra, if you'll notice, I can make the tip narrower, too narrow, narrow enough, a little less narrow. So I can adjust it to give the patient an idea of what's possible, and in consultation, of course, with the patient, we can decide what she likes and make a surgical plan that will give her as close to that result as we can. We can also adjust the profile. For example, if there's a hump on the nose, we can reduce the hump or raise the nose if the nose is too small. So we can do all kinds of things with this Vectra system, which really makes it possible for the patients to visualize what the different surgical steps can achieve. So once we've come up with a plan that the patient and I both agree on, then we can go about and take all the proper photographs, do all the proper tests, and then go ahead and schedule the surgery. The surgery itself usually takes about an hour and a half. It's done with a light general anesthesia. It's an almost painless surgery. Most people are surprised how little discomfort they have after the surgery. Most of my patients take very few, if any, painkillers. You do have to have a cast on the nose for about a week. There's a bit of swelling and bruising, but most people after about 7 or 10 days after their surgery look fine and can go back to their work or social activities. And the result evolves. You see an initial result which continues to evolve as the swelling goes down. And usually by around the 6-month mark, you have a firm, stable result which will last, obviously, a lifetime. So rhinoplasty surgery is a fantastic surgery. It can really change the balance between the nose and the face and give patients more self-confidence and certainly a look that's more appealing to them, especially in photographs. So if this is something that interests you, I'll be more than happy to discuss it with you in a personal consultation and using the Vectra 3D photo system to give you a good idea of what you can expect. So thank you very much.